Okay, we're going to go ahead and call this to order. We're going to start out with a few comments, and Judge Witham's here to address an issue that he and the judges have on their minds. And Kyle Allen is on his way, should be here in the next few minutes. Mike's he's held over at work, so I'm not sure, he'll be a little late. And Betsy is under the weather and will not be here, but we're going to have live stream shortly, or we do, I think Debbie said. So this is a work session, so we can't make any votes or decisions, but we are brainstorming and heading into this summer's budget hearings. We need to figure some things out, especially relating to lit and needs from different departments. Shannon and I attended the ICCA, the Indiana County Council's district meeting, East Central Indiana, held at Primo's this week. A good half of it was discussing legislative bills that were actually getting traction, several of which will affect finances and public entities and our budgets, and we'll talk about a few of those later. There's a legislative session of AIC coming up. It's at the bottom of your itinerary. You can read over that. I have a Zoom tomorrow on the Legislative Committee of ICCA, so I'm not going to Indy. I have a conflict, plus I get all the info I need on legislative bills every other Friday on Zoom. So at that, I'm going to turn it over to Shannon. He's got a few words and updates for us.
I just wanted to preface this work session with what Kenan mentioned, the local income taxes and what our options are. And we have seen last year's state legislature limit our receipts and reduce our receipts. And paying attention to this year's state legislature, it looks like they would love to reduce it even more. We have trimmed the fat as much as we can. We talked about that in the budget session, and we had Jason Semler come visit with us in December to talk about what our local income tax options are, what requires us to visit with the Henry County Tax Council, and what we are able to do without the Tax Council on our own. Jason did clarify some things for us, one of which is each entity, this county council and the county tax council, can make changes to local income taxes once per year. So doesn't mean it all has to be at the same time. If you remember from December, the jail lit, the EMS lit, and the judicial lit is the responsibility of the county council. We have the option to pass and change those things as we see fit. The tax council is not involved with that. Public safety lit will require the tax council to be involved if we make changes to that at all. So we're not the only ones doing this. My discussions with Jason Semler has him running all over Indiana, meeting with municipalities and county governments to help them develop the necessary changes to shore up their budgets due to what we're seeing across the state. So the work sessions were a good opportunity for us to get everybody together and ask questions and hear from those that are impacted. And tonight's work session, we invited EMS to help us and understand what is being done at their area, how we interact with Newcastle EMS and the commissioners. Bobby is here and Joe is here. There he is. Can help us understand what our contractual agreements are or what necessary costs we have in the future with the agreement with Newcastle. So that's what we're hoping to get out of tonight's EMS discussion, what our costs are moving forward with Newcastle EMS, what our costs are moving forward with Henry County EMS, and is there any overlap? What does the budget look like 3 years from now, kind of a thing, so we can understand what we're doing. With that, I'll turn it back to you, Mr. Chairman.
Thank you, Shannon. Judge Witham has asked to speak with us. I think from an email that this may have to do with CASA, but I'm not positive. So just make sure the green light's on and we're all ears.
It's good. All right. Just a little bit, first of all, with CASA, it's court-appointed special advocate. Susan Stamper's been CASA for over 20 years. She's retiring, I think February 9th is her last day. We've advertised for the position. She's had several calls about the position, but we haven't had one applicant yet. Normally they call and talk to her. Some seem excited about it, but then they ask what the salary is, and when she tells them the salary, which is a little under $32,000 a year, most of the people have said they can't even consider working for that amount of money. And I don't know, I've only been judge in Circuit 1 for 7 years. I didn't deal with CASA when I was down in Circuit 3, but my understanding is back years ago, there was an agreement that the salary would be reduced, I think about $14,000, with the understanding that $1,000 would be added back to it every year, and there hasn't been any added back to it.
I don't think that memo got carried on to us.
14 years.
First I ever heard of it.
I did a little bit of research. A brand new family case manager with the Department of Child Services, they just had a raise not too long ago. They start out at $47,000 a year. It's not required that they have a college degree. If they have a high school diploma and 8 years of experience in the human services job sector, then they would be able to be an FCM, and then it goes up from there as far as associate's degree and things like that. So at this point, we're having a very, very, very difficult time being able to fill that position. The CASA does work. Susan is the director of the CASA office. She has volunteers who work under her, maybe on individual cases. But in almost every CHINS case that I have, a child in need of services, we have a CASA appointed in almost all of those. A large number of our juvenile delinquency cases, we have a CASA appointed on those. Also in divorce and paternity cases, I will appoint CASA to go out and interview kids, make a report back to the court about custody issues, things like that. So it definitely is something that is vital for us to be able to continue to work on those cases. If I don't have a CASA in the JC cases, then I have to look at appointing a guardian ad litem, which is normally a local attorney we have come in and file a report back with the court. And you can imagine the cost of an attorney compared to having the CASA office there. So I guess two things. One, I wanted to just give you an update on that, and two is ask for some help. Now, I have talked to Susan. We do have some funds available that I could use to supplement, but it's not going to last very long. So I understand with things the way they are right now, but I was hoping perhaps at least to get you to look at in the future if the council could help us out some, because I don't have an unlimited amount of money that I can use to supplement. What I'd like to do after talking with Susan is possibly look at using some of our funds to increase that salary, at least for the next year. Perhaps we could fund that difference in the salary to get it up to somewhere in the $42,000, $45,000 range so we can get someone here. Now, I'd like to get someone here who does a good job and stays for another 20 plus years is the goal. But I think in order to do that, I'd like to have some guidance from you folks to tell me that, yeah, we'll work towards trying to make sure we can maintain that salary. I don't want someone to give up another job and then 2 years from now come back and we're out of money and I can't pay them anymore. I just don't think that's fair, and I don't think that'll get us good applicants.
Just historically, when was that, when you said that 1,000 was going to be added back? Do you have a date?
I think it was sometime back in 2009.
Okay. Okay. Right now it's a Pat 1. It's the only Pat 1 that we have in the whole county, and low is 39 according to Wagner Irwin Sheely, and full is 44. So I'm not on the job classification. Those two are, and I'm going to let them have at it.
Yeah, I've done a little bit of looking into this. My understanding is that this position was classified as a Pat 1, and in my research that I looked through, we didn't have any Pat 1s on the payroll, so we don't have a dollar amount approved for a Pat 1. Do you know if that position is grant funded at all?
There is a grant from the state, and then also I think it's a matching, the county has to match. I think the match is 35,000. Yeah, well, last time I looked at the budget, I thought it was like 35 or 35,200, something like that.
Our current salary from Wagner Irwin Shealy last June was $30,375, which is one of our lowest positions in the county, if not the lowest currently.
Using what we've tried to do for the other PATs, which was to get to a certain percentage or close to a percentage below what the full market is. The full market, as Kenan mentioned, was over $44,000. If we applied the 88%, which is what the average is for the other ones, that salary comes in at $38,854. We can't, of course, do that tonight. That would be something we would have to have a salary ordinance to vote upon. But what I'm hearing from you is you're needing more than that.
Yes, and I think there are some funds that are available that I could use. Like I said, I'm not asking the county to go ahead and make up the difference. But I guess, want some assurance that if I do this for a year, that in this next year, we'll talk about it and see if the county can't come in and help some, so we don't have to use all of the funds that are there.
My question would be whether or not that position still is a Pat 1. And so I think Wagner Irwin Shealy is conducting an entire evaluation for all of our job classifications. That position should be included in that. If it's not, we'll need to get with Stephanie and make sure. It was left out of Wagner Irwin Shealy's study a few years ago is why I didn't have it on the list.
Right. It just showed up this past June, first time ever.
So
Also was a separated position.
I would hate to, I certainly understand the predicament and I don't know, if we can ask Wagner Irwin Shealy to move that position to the top of the list, that would be great. Personally, my opinion would be if it's currently classified as a Pat 1, I wouldn't have any problem approving a salary ordinance for that $38,854. But anything beyond that, I think we would need to have further discussion and evaluation of that and see how it goes. That's my opinion.
Yeah, if it were to move to a Pat 2, what we're paying other Pat 2s with the 5% increase this year is $41,045.
No, the $46,379 is the Pat 2 adopted wage.
Oh. Well, I'm looking at community corrections and they're a grant too, so they may be lower because of that. That was just the first Pat 2 I saw. So, okay. I think we're open to maybe expediting Wagner Irwin Shealy to analyze and look at a job description.
And I know we got an email about picking something up from Stephanie, I think. Would CASA, it would be in there too?
It's not, we'll get a copy.
Okay. I'll try to run over tomorrow and see if we can find that. Okay.
But if CASA's not in it, we'll call and see if we can figure out where the job description is.
Okay. I appreciate you letting me come over and talk to you.
What the rate is.
Sure, yeah,
For everyone, but we've been inching towards that, especially this past year. So we're open.
Okay, I appreciate it.
So thank you.
All
Could
right.
you also check the other judges
I'll
about the
check and see.
18th?
I've got the 18th on mine, and I'll check and see if the two of them are available too. I'll let you know.
Okay, thank you.
All right,
Thank you
thank
for
you,
coming
guys.
and speaking with us. Is there anything, other questions or comments relating to CASA? If not, whoever from EMS, Mandy, Bobby, Brian, whoever, if you could come up here, we don't even have, I know we have 3 chairs, and there's one over here you can bring up, but we have a microphone on each side, so. We can share. Yeah. And as you know, as long as it's green, it's on, it's live.
Oh, sure, make me sit in front of the microphone.
Bobby may be joining us.
Yeah, share right here. Oh, Bobby, sorry.
Made kind of an outline there at the microphone of things, but we're gonna, I think, just turn it over to you and share. I will say that I listened in yesterday to a hearing at the State House, and it was on House Bill 1385, and it was about insurance reimbursement for ambulance runs, EMS runs, at 500% of the Medicare rate, and that's currently still live. So, and we heard testimony from people around the state, the person that was over the Fort Wayne, Terre Haute, some companies that operate multiple counties as businesses, and they're all having the same issue that we've heard from you, Mandy, and Brian. They're not getting paid nearly enough to keep things afloat in the black. So it's a statewide phenomenon. Every person spoke to that concern. So I'll just turn it over to you, whatever you want to share, because we're needing to figure out what to do come budget hearings. And there may be some laws that's going to dictate some things, what we can and cannot do, that are still in the works. Go ahead.
So maybe why don't we let you start first, and then we'll segue into the...
So as far as like budget sessions go, I think when I was talking to Shannon, he asked me to answer some questions that you guys might have about what we do and how we do it, basically. The amount of runs that we take just goes up. It just continues to go up. And basically, we're the BLS primary transport out of this hospital. We also have now under contract with all of the nursing homes.
Bobby, you might want to get the other mic so you had.
So we're under contract with all of the nursing homes now in Henry County. So what that does is, one, it protects us that we don't just take non-billables from those facilities, because we rarely turn them down just because there is no one else here or around here that does what we do, especially just for this county. So when we got them under contract, that made that even if they called us for a run, said that they qualified to go by ambulance, we get there and we say they do not qualify to go by ambulance, we're left with a choice. Leave them sitting there, they miss their appointment. It starts whatever health problems they're going to have, right? We all go to the doctor for a reason. They have to stay up on them. So we would take them. Those became non-billable, can't bill them. When I got them under contract, there is no such thing anymore as that with these nursing homes. If they fill out a PCS and they say that they can go by ambulance, we get there and find out that's not true. We now bill the facility.
It's a PCS.
A PCS is a statement that a nurse or a doctor will fill out that says this person has A, B, and C, and here's all the reasons that they can't go by a car or they can't go in a wheelchair by a van, and whatever supportive.
So that they can do their job.
Basically, it's whatever supportive care they require from an EMT in the back of an ambulance, that's what this says. That it has to go through. They fill it out. We double check it. We send it. We audit it in a run that gets sent to insurance. Ambulance billing then audits that PCS and that entire run with everything that we did, and then they decide if it's billable or not billable. Henry County used to be awful at that. I did pull some numbers, and I can make you guys copies of that. We went from 574 non-billable runs in 2021 to 64 in 2023, with 27 of those being sent to facilities. So we're in the 20s of non-billables. There is no other way that we make money. That's it. So we had to get that tight, right? It's not enough. So now we went from trying to stay open till 8 p.m. when I first took over to in September of 2023, we went officially, or 2022, we went officially full-time 24/7. So all of 2023 numbers that I have are 24/7, around the clock, and we just keep adding on to what we do. And what we do is we help the coroner out. If the city gets overran, we help the city out. We do trainings, we do stagings with the parks and all of those things. We go to the schools, we do career days. We do all of those things, plus we never have stopped doing everything we always did, BLS-wise. And if we can help someone out, we're going to help someone out. We have gone up probably 450 runs since I first took over to 2023's end numbers, which is pretty good. It's midpoint back to where we were even when we were ALS, and that's a lot when it's a BLS call. Because usually BLS calls aren't, we're going to run to the scene and then take them to the hospital. These are 2, 3, 4 hour calls that we get on. So that's a lot of calls. It takes up a lot of time. To do that also meant that our payroll pretty much tripled when we went 24/7. But what didn't change is that from 11 p to 7 a.m., we're just there to help them out if they need us or when the hospital calls. There are no appointments. So I have a crew that I'm paying an above average wage to keep them there with no runs half the time that come in, right? But it's still got to be there. Because when we are needed, we can't just call them in. Hey, can you come in real quick and back up the city? It doesn't work like that. Or the ER needs a transport to Methodist. They've got to be there. Sometimes they run, sometimes they don't. Sometimes, especially recently, they run the entire shift, which is awesome. But I'm not going to pull funds for that for probably 6 to 7 months, right? So that's kind of what we do. That's how I operate. I'm always looking to cut corners, bring more money to us as a service while paying out less for all the things. But the one thing I can't cut is wages. If I cut wages, I lose people. If I lose people, I lose trucks. We don't, it all, do you understand? It all snowballs.
Maybe can you explain the report you gave me that year ago, what gets billed versus what gets written off versus what's adjusted versus what Henry County EMS actually brings in? I mean, I've got it on my desk if you want me to get it for you.
Right. So, and that's, Brian can attest to that too. Recently, well, within the last 6, 7 months, we talked about starting balance billing. And everyone just were beside themselves when that was just one way we thought we could survive as well as them. What was put out there and what the truth is a little bit different. So if we bill, say, $4,500 for a transfer or a run and it went 100 miles, first you have to go over a certain amount of miles before you can start billing for miles. And then depending on if it's BLS, ALS1, or ALS2, that's the rate that gets paid for that mileage. And I know there was a lot of things that people put out saying, well, they increased these rates. Those are pennies on the dollar when it comes down to the end of it. But we also can only charge CMS rates. So we can't just say, oh, well, we were going to bill you $5,000. There's a threshold you cannot cross. If that person has Medicaid or Medicare, there is a rate that you charge them and you don't go above it. Then insurance gets hold of it. Well, we don't believe that or that. We don't think they needed this. And next thing you know, you've sent a $4,500 bill, and it's dropped down to maybe 622 is usually my going. I see 622 over and over and over again for a really high amount. Well, then if you take out ambulance billings fees for that, the crew that I paid to put on that run and the time that they were gone, all the fuel and expenses on the truck, we've made a very little amount. And I think that what really happened with the balance billing thing, we wanted to do it. It would supplement, help us a lot, but no one was ever going to get a full bill. We could never send you a full bill, especially if you were on Medicaid or Medicare. We could only bill you that amount after insurance paid. And then you could always call in or write in to ambulance billing. You can fill out a form and say, I just can't pay this. They'll get with me, and I would say, okay, can you pay anything? Even if it was $10. And then we write the rest off. It never meant people were going to go into collections, but it never even got that far where anyone could explain that. So it just sounded like you're getting a $50,000 bill, and there's no way possible it could have ever been that.
And what you're describing sounds identical to what the lament was at the hearing at the State House
Yeah,
yesterday. It was everywhere.
Well, I mean, I'll tell you, so we billed $7 million on our end last year and collected $2.7 million. So that's,
Yeah.
and that's statewide, nationwide. I mean, that's,
And where did that put you in the bottom line come December 31st? How much in the red or black did the billing versus payment?
That's a trick question.
I know.
Yeah, that's
Do your best.
Well, first, let me preface this by saying, I know some people wonder what the two services do. Yes, we both drive ambulances. Yes, it says ambulance on the side of it. Mandy does the transport side of things, and we do the emergency side of things.
That's good.
So I know that's a big, people that don't know what we do, they always wonder, well, why do we got all these ambulances? And we are the ALS provider for Henry County, which is paramedics, advanced life support, yes. If you look at the public records for last year, our line finished 512,000 to the negative. Now, we are doing some stuff. We have a new clerk treasurer, so, who knows what that's going to really be when we get that figured out for sure. Is it going to get any better? No. I don't believe so.
Well,
But-
maybe, I don't want to interrupt, but maybe if they do pass that 500% of the Medicaid and Medicare rate, which I know on those cases, I don't know what percentage you do that are Medicare, Medicaid patients, but I would think that would help greatly.
I didn't bring that report, but I think our Medicaid is 16-ish%, Medicare's
So it'll
Maybe
help, but not maybe greatly.
40. Well, the change in the Medicaid rate that happened last year will help us a little bit. You know, Medicaid now is required to pay the Medicare reimbursement rate. So that'll help both of our services some, but not, not millions of dollars, because that's only 16% of our volume. I'm not sure what it is in Mandy's.
What's the Medicare rate?
Off the top of my head, I'm not
Thought maybe
sure.
there was one single.
No, there's not one single rate. It's going to vary based on,
I
your
understand.
BLS, emergency versus
Is it
ALS.
on
one.
average a certain percentage of, say the run is 4,500, what would you, it's just too hard to
There's
tell.
way too many variables, especially for us, where they're getting the PCS, a physician certified statement that says this person needs to go to the hospital. If you call 911 and you want to go to the hospital, it doesn't matter what for, we have to take you. If you call and say, hey, I've got a headache, we have to take you. Your insurance isn't going to pay for an ambulance ride. We don't get a say in that. No, nobody does. So that's kind of the difference there also.
These corporate insurance companies, they hire nurses and medical staff to get out of paying ambulance bills. They try to, you say, oh no, Bobby, you weren't having chest pain, it was belly pain, and so we're going to pay a basic life support rate, not an advanced life support rate, even though this is days or weeks or months after we've spent, the medications and the supplies and, all that stuff, saying, oh yes, this is ALS. These corporate insurance companies and these big insurance companies, they don't want to pay. That's the difference between today and 25 years ago. 25 years ago, you could get anybody an ambulance ride paid for, anybody, and now it's not the case.
Do you feel like that's one of the main reasons, or one of the main reasons that costs are not coming is the reimbursement is just not what it used to be?
Absolutely.
That's the number one reason why you can't hire people, because you can't recoup enough money to
Yep.
operate in the black to pay people a wage to get them to do this job.
So whereas 10 years ago, it was a possible kind of business model to self-support as a EMS service, it's just not
No.
going to be anymore. Is that?
It probably started going down about 10 years ago-ish, but before that, yeah. And some of these services, unlike our two, private services, hospital-based services, they bill you. They'll take what your insurance pays, and they're going to submit you a bill and then take you to collections. The private companies, the Heartlands, I'm not picking on any, the Heartlands, the TransCares, Seals, stuff like that. It's how they make money. That's how they can pay their employees $70,000, $80,000, $90,000 a year, because they're billing for services they provide.
So stupid question. You said you're required to pick anyone up if they call for headache. Required by who?
Law,
Federal,
law, yeah.
state and federal law?
If I call 911 and said my toe hurts, I need to go to the hospital,
Yeah.
We don't take her, that's patient abandonment, and that's a crime.
So the state and federal law requires, and then there's no reimbursement.
now, if I call 911 let me rephrase that. If Mandy calls 911 for me, and they come to me, and I go in the back of the ambulance, and I am of sound mind, and everybody can question whether I'm of sound mind ever, but if I'm of sound mind and answer the questions correctly, and I say, I don't want to go to the hospital, I sign a form and I get out of the ambulance, even though she called thinking and knowing that I probably needed to go to the hospital, and that I was probably not of sound mind. But I can, as long as I can answer the appropriate questions, I can say I'm not going. But if I call the ambulance, you can't say I'm not taking you.
I can't tell her I'm not taking it. I mean, we can try to convince people they don't need to go, which we try to be good stewards of the healthcare system.
So you can say, I've evaluated you and I don't really think that you need to go to the,
You're gonna go to the emergency room, you know.
You
You
can,
can't
but not
diagnose anyone
officially
out there.
because,
Like,
you
you
know.
can't give a full-on evaluation and you're fine, because then you're gonna put yourself in a position to, what if they really are? You've just told them they were.
But you can have a conversation of, do you think that this, do you think you need to go via ambulance lights inside? You can have that kind of a conversation. But again, if they say yes, then they get in the back and it's a right to hospital.
I mean, that would be a liability nightmare. The one time that we were wrong would cost you more than
Yeah.
the
Eating the run
the
itself.
eating the run itself.
Yeah.
It's
To partially answer your question, again, just listening into that very interesting hearing, which was the insurance committee at the State House, several of them said they were getting reimbursed 1/5 to 1/10 of an actual from on Medicaid, Medicare. They said that was the range. That's one reason that they put in the 500% of whatever the rate is, because they said even that would not cover actual costs, but it would come a whole lot closer than what it is now, which you're losing.
About 70% of the people in this area are Medicaid or Medicare.
It would affect you more positively if that were to pass than Brian.
I mean, it would help, yeah, but I don't see them moving much on, I just feel like there'll be some kind of meet in the middle type of thing.
They talked about, the committee was talking about 400%, so it may not come out 500, but it's currently written 500, so.
so are the the negotiated rate that Anthem would have, I have Anthem insurance, does that cover your costs? I mean, I know it's different for every person, but if you have a private insurance company, is it covering your costs?
It's closer, but the insurance company will try everything to get that knocked down. They will, it has to be, I mean, it's just nonstop. You're battling them, you're battling whether or not this person qualified in everything, because everything you do, even if we pull out a nasal cannula and put that on, we should automatically at that moment bill at a higher rate because we are providing treatment. But then they're going to go pick that apart and say, well, was that reading accurate? Did they really need that O2? And before you know it, you're back down to, it didn't matter. It just didn't matter.
What we heard at the hearing yesterday was insurance companies had, a lot of them had agreements with some ambulance providers, and there was a set rate for that, and they established normal and customary, and I cringed when I heard them say that on the thing yesterday, because I've heard my own insurance company say, we're paying normal and customary, and you're responsible for everything above that. So in your case, your Anthem might pay normal and customary charges, which at that hearing yesterday, I think the guy from Fort Wayne said he thinks is about 60%, which is better than the 20%
Yeah.
that Medicare paid. But you can't operate a service collecting 60% of your costs or 20% of your costs, which is why even the counties that I've spoken to that use these for-profit ambulance companies, they have a county budget paying those for-profit companies just for having that service in-house, and it's expensive. So my question kind of goes to, you know, we've heard a little bit about how things are today. How do things look moving forward? I know we are paying, I've got the EMS budget up. It is 800 and my phone needs to stop. Sorry, guys. It is $803,000, $803,790. And we also have $300,000 in public safety lit to pay Newcastle for EMS services. So we have $1.1 million that we've budgeted for services. We understand that we have an obligation to make sure that those services.
Well, the 800,000 though,
800 is not out
you
there.
guys didn't do that.
You guys don't, the county has put no money into that
Yeah.
$800,000.
Okay.
That is lines there.
That is what they.
That's your budget.
Yeah, and when we get
But
closer
it's
to
not-
the
I
end
just
of the
wanna make
year,
sure
yeah.
It's not county general money. That's
Cor-
the money
correct.
that they bring
Yeah.
in.
To
Correct.
actually use all that budget, I have to actually pull all that in. There's a lot in there that I won't even be able to use. I'll never make that money at
Okay.
this rate.
So I guess I'm trying to look at it as big numbers person. Okay, 803,000, 300,000. What does next year look like? What does the year after look like? How do changes, is the way things are going to continue and that's how it will be moving forward? Or are there things that are coming that we need to be aware of to make changes? I want to try to build a financial plan to be able to meet the needs for EMS for the citizens of the community. And with the knowledge that I have right now, I don't really know how to build that plan. So I'm asking what we look like here for the next couple of years so we can do that.
So I'm going to give a little history lesson. So historically, pre-2011, Henry County and Newcastle both put money into Newcastle Henry County EMS, as it's called. In 2011 is when, and correct me if I'm wrong, I believe it was 2011 is when Newcastle EMS started doing insurance billing.
It was before that, but the county's previous of the 300,000 from ARP funds has never actually funded Newcastle EMS.
No,
They funded
I'm talking prior to the ARP funds, prior to Henry County and Newcastle had an agreement.
on dispatch, and there
Oh,
was
it's
there was
just-
there
okay,
was
I thought
money
it was
given to
on-
dispatch,
I
and
thought
it
it
was
was
more of
EMS.
a handshake.
Okay.
There was, we're going to put this money into so I started here in 2009, so if I'm off just a little bit here, but money was given to dispatch, and dispatch was co-directed from the city and the county, and so the city paid more into dispatch than the county did, so we provided the EMS coverage for the county. There was never any funds exchanged for EMS solely.
And then in 2011 is about when you guys started doing your insurance billing.
I would have to go, that eludes me, but I believe that
Roughly.
number was like 2004, because ABS
Was
has
it
records
four?
to 2004.
So at some point, and in some of the documentation that I had been reading, and it's a little convoluted, so yeah, it's a lot convoluted. So they started functioning off of their insurance billing. Kind of the same time frame-ish, I don't know, when Henry County EMS started under the sheriff's ambulance, they did everything under the insurance as well. And at some point, I mean, it was pretty,
It was very lucrative.
very
And
lucrative.
had it maintained being ran the way that
Right.
it was when it
It was
initially
very
started, could probably still be lucrative. I think at some point it would have suffered just like we are now.
Right, exactly.
Because expenses are higher and higher and wages are higher, but the return is not higher.
Right.
It's pennies is all they're making, and it's going to crash the entire system as a whole.
Yeah.
And
So-
I don't know what to do about it as far as there's no more corners for any of us to cut that we haven't already cut.
so we did $300,000 of ARP money to buy an ambulance.
To help with operating.
Operating expenses. Originally, when we first talked, we were going to use it for an ambulance. Operating expenses were, purchasing another ambulance at that point didn't make sense. It needed to go into operating expenses just because it cost us that to operate.
Yeah, they were paramount to them at that
I'll talk to you
time.
about this afterwards. Okay, so, and then we budgeted $300,000 for this year to go to EMS. And I know everybody is aware that Henry County commissioners are statutorily obligated to provide 911 service to county residents. So, Newcastle Henry County EMS provides that and has done so for a long time without any money from the county at all for years. So we are statutorily required to. And they're not going to do this, but I'm just going to use this as an example. You guys can say you're not doing this. If tomorrow they said Newcastle EMS is no longer going to leave the city limits of Newcastle, they don't have to. Then it's up to the county commissioners and the county to fund a different service to provide 911 service to the county, which is going to cost a whole lot more than $300,000 or even $500,000.
they're not gonna do that, so if Travis and all of them are from the Courier Times, they're not gonna do that. It's just an example that it's something that could take place.
Is that something that has ever been
Yes.
considered to be put in writing and
It was, well,
signed?
I will say it was done before.
Yeah, back if you look through the early 2000s, there's some documentation about X number of runs in the county and X number in the city, and if you did some math and what dispatch was and all this, it's very convoluted, like we said earlier. Joel is working on a contract for service, since there is money changing hands. I mean, we've got to have a contract for service just to hold us all accountable. With that, there's no rate. It's not going to say $300,000. It will say negotiated yearly between the municipalities, however the legal wording that Joel says. I mean, he's the city attorney, as y'all know.
So we're evolving past the handshake. We're actually going to
Yeah, so we're getting past the, I'm going to do this if you do that, and we just won't
Public
tell
good.
nobody. We're trying to do it the right way, and he's drafting up an agreement for services, contract for services for us to use moving forward. And then as far as the money, the dollar amount, I mean, we could break it down. 40-ish% of our call volume is county runs, with the other 60% being in the city. Our operating budget's 3.5-ish million. We recouped last year 2.7 million. So this year we're trying to figure out just exactly where we're at with our operating expenses, and with the $300,000 the county got budgeted in, what the city is going to still have to potentially make up. So can I sit here and tell you that next year we're not going to need $500,000? I can't. The county EMS, they provide a needed service. They help us when we need them. I think we called them 6 or 7 times last week. They've never had to tell us no. We like to help each other. We just had to go to Charlottesville last night because all the Hancock County ambulances were on calls or on fires. They had a fatal crash, in the fog. And you're seeing a lot of that because there's not enough people, and we have to help our neighbors.
Yep.
So I have a question for you. You said your operating budget was $3.5 million and you collected $2.7 million. So that's
$800,000,
$300,000 from the county. Does that mean that the city actually has $500,000 in their budget, or is it open and you go tell them what you need, or how does that work?
No, it's very kind of sketch. Did I say that? Am I allowed to say
He's
that?
laughing at my question.
Am I allowed
It's a
to
great
say-
question. I'm laughing at the answer that's coming.
Am I allowed to say that? Yeah, right. Are you hiring? Mandy, you hiring?
Planning to run for office.
Yeah, I am.
This is good practice.
Yeah. All right, now, ask me that question again. You guys got me all sides. Okay, so the city, we were told last year that the city had budgeted $500,000. We found out that the certified salary, lack of better terms, or certified budget this year only had $300,000 in it for EMS supplies. So we ride that supply line out to the first $300,000 of everything but our salaries. We pull the salaries from our non-reverting fund, which was set up in 2020, starting with 21, where all of our revenue would come to a non-reverting fund. That was not accounted for the growth and the increase in costs and COVID and the decrease in reimbursement. So that model, just wasn't going to be where, it used to be, the unit has millions of dollars in the bank. We've been in the hole for, like I told you, those of you that remember from the ARP talks,
Y'all
3
go to
years.
the city budget session and request a certain amount of money from them?
Well, that was never how the city operates. So the clerk did that.
There was no city budget session
There's
for
no
us.
budget session for
Yeah,
us.
they did that, yeah.
So, yeah, I'm just curious, it's not at all like county, city versus anybody else, because we're all in it together, but my mind is just thinking, what do they consistently contribute? If we do pass some type of EMS tax, are we covering their current portion of it, our current, this is why, what is our total expense that the county's funding? We know ours is 300,000, plus if we pick up any of you guys, so I'm just trying to think, what is the total expense for the county, which I think is where Shannon was kind of going to, and then what do we think that's going to be over the next at least 3 years?
So we've done a big restructuring in the last 6 months. I mean, it was no secret that we stopped doing hospital-to-hospital transfers on the ALS side. So we've cut crews down, which has decreased overtime costs. We've decreased fuel costs. We've decreased maintenance costs. It's going to take us 6 months to really understand where we're at to give you an honest answer as to what we really need. To do it right now, we're just shooting a number. With this restructure is big. I mean, you're looking at over $500,000 in overtime saved alone. Fuel cost is really hard. Maintenance cost is kind of impossible to figure what the difference is going to be, but you're cutting out 50,000 miles traveled a year. That's going to reduce maintenance costs. So without a solid 6 months of footing, it's going to be, I can't tell you. We can't tell you an exact number.
So this July, you might have a better idea, like when Mandy comes in at budget hearings, you might have a better feel. You'll have more of a year type.
I think that's fair.
Ambulances are a major expense, I know. Some of the hearing people who are talking around the state said one of the ways they've been saving is they remount, put a new chassis under it. Do you do that? Is that a regular replacement schedule?
We do, and they'd passed an ordinance on that, and we're still trying to move toward that by the end of the year. You're ordering an ambulance a year out. We've got a new chassis sitting at the I Avenue station to be remounted right now. The time frames, to get new. But ideally, we'll remount one of our fleet and get 2 new at the beginning of 25. That's a project we're already working on to do that.
Okay.
And then remount, because it's 40%-ish,
You may have answered this. Susan asked about the 3.5 versus you said 2.7 million reimbursed. Does that include the 300,000 from the county, or is that on top? So you actually, the difference is 3.5 versus 3. So that's the $500,000 you're saying deficit.
Yeah,
that number doesn't include the 300,000 that's budgeted from the city or the 300,000 budgeted from the county. The 2.7 million was simply what we collected in revenue.
So if you add the 0.6, you're 3.3, and that's only 200,000 in the red.
In a perfect world, I'm going to give you, in a perfect world, yes, we're close. However, there's another caveat in there, and it's health insurance premiums, because we haven't taken our health I'm trying to. We haven't paid our health insurance premiums out of our non-reverting account yet. So, and I can't tell you what that number is, and I can't get that number for you. I wish I had it, and.
It's not insignificant.
It's around 3.
Yes, we are working really hard at this point to find those numbers. If I could, just something I could go get for you, I would be happy to have that.
So setting aside health insurance premiums and the fact that you completely restructured, you could theoretically only be $200,000 short.
In a
that what you're saying?
perfect world, yes, and
Okay.
that's.
But there's a lot of
There's a
unknowns.
lot of factors,
Yeah.
It's, do I have one person leave? Now my overtime cost is greater. There's a lot of unknowns. In a perfect world, yes, we should operate close.
We've heard a little bit about what your guys' plans are and your restructuring, and we're going to have, time will tell maybe on some of those numbers. Mandy, can you talk a little bit about plans for your side of the business and in future, restructuring, future costs, what do we need?
So we are getting to the point where we're almost going to need to add another truck at least for part of the day, just to the influx of calls. We're running crews half ragged, and it'll end up costing us employees or what it'll be if I don't add another truck. So we at least need to expand to that. We also got a waiver to go back advanced. My goal is by the second week of February will be advanced service, which is the in-between BLS and ALS. It's right in the middle. And then Lucas should be a medic by May. We can get a waiver to go back ALS with him being a medic, and all provided that we can get to the council on job classification. We have all our new job descriptions, our new polls and everything have been done for us. I just have to get them to you guys so that you can look at them.
Yeah, you had that through Wagner and Shealy, like the health department
Yeah,
did,
we've
and
already
you do
got-
have that.
We have all of those. We got all of those back. So I think that we will be, our original goal was 2025. We're going to be close to that, if not a little bit sooner. I didn't expect to go midway, to go advanced. It's just an opportunity that came up and we were encouraged to do it, and the state was supportive, so that's what we're going to do. I'm not sure exactly how much that's going to help us at first, new territory.
So Brian, you'd mentioned that right now you do 40% county and 60% city. If Henry County, when they go ALS, how's that going to change, do you think?
It will only change if they need us.
Yeah, it won't, because we're still the emergency provider
Yeah.
for emergency calls.
It means that they will be able to do ALS out of the nursing homes.
Well,
Transfers.
it's
Right,
the
they'll be able to
transfers,
do-
yes. We're trying to get back
Well, the thing
ALS
is,
to
yes.
alleviate the transfers, because right now, anybody that's out there that is getting an ALS transfer, they are balance billing. The people they're using, they're going to balance bill. And that's going to come back around. There's not a lot of noise about it right now, because it takes a while to get a bill, and this hasn't been going that long. But it will start, you'll start hearing it, because they're going to get bills, where we get that $600 for that transport because they wrote off $3,700. Those patients are going to get that bill because they do balance bill. We don't.
Also, with them going back ALS, when we use them for our backup emergencies, we won't have to, we'll know we have an advanced life support truck coming as well, instead of worrying, oh, well, do I need to try to free a medic up? Do I need to send one from somewhere else to intercept with them guys and gals? So it'll help the community in general.
Having two services is complex, and I commend you guys for working together and doing a great job with that. Not stealing employees from each other and doing those kind of things is tough.
Used to be kind of the
We
norm here, I think.
share Lucas right here.
Right,
He works both places full time.
And the way they're both structured, you can work at Newcastle EMS and work at Henry County.
Yeah,
EMS
we've
at the
never
same
put
time.
anything on any of our
Right,
employees.
and
They can always.
you
apply
guys
that.
share equipment as well if somebody needs
We need
something.
it.
Absolutely, we've used their stuff.
I just wanted to mention that and commend you guys, because that is not necessarily the case everywhere.
It's
Oh.
not, but it's not that it's complex. It wasn't hard, I don't think at all, once you got people that were like.
You had a willingness. That's, again, historically,
Right.
that's not always been the case. At one time, it was a competition.
It
Who could
absolutely
outdo the
was,
other?
and yeah, we're in great graces with each other. I mean, I'll go on record saying that we did in the fall when we stood up here and did public meetings. We got a great working relationship. Two services do. So
Good
we
to
want to
hear.
keep that.
So could you guys give a brief answer of the advantages and disadvantages of merging these two services?
We do two completely different things.
Yeah,
We tried that. I mean, we did ALS transfers and BLS
politics gets in the
transfers.
way of that.
A day in the life of a Newcastle EMS employee, 6 or 8, let's see, when did we stop? October. So 6 months ago was you might take Bobby to the hospital, and then you might pick up a transfer and go to Indianapolis, and that's a 3.5-ish hour turnaround where you're managing a critically ill patient. Then you might come back and have to take Kenan to the hospital and then go pick Debbie up, and you exhaust your people.
Your people, your resources,
Doing
and
that.
someone will fall in the cracks.
There's
The perfect example is Henry County EMS in 2020.
There's
What
very
happened?
few services that do all that together.
Yeah.
They thought it was going to maybe be a money cow. It's not. Municipalities typically don't do transfers. or non-emergency runs.
Whenever you look to see how these systems are set up, I mean, it's not unique for Henry County. Every county, except for maybe Marion County, because they have all the hospitals there that can do absolutely everything. You take somebody to the hospital, they need a high level of care. They're going to need transferred out to a different hospital. Most everywhere you go, those are two completely different services that pay two completely different pay rates because each of them have their own unique challenges. It's exhausting to do a 3.5-hour transfer, but you know, they typically pay a different wage for that because they understand that you're spending more time with a critical patient and all that. It's just it's so different of a job. It's the same job, but there's just so much different that you can't merge. You just can't. It wears your people out, and it just costs too much.
So to me, it's not at all argumentative, but a lot of times you have two different branches in the same group that do two completely different tasks. And they're just like in a company, you know, you would have a group that does this, they'd be paid differently than a group that does. So I still don't understand. If anyone has anything else to make it more clear, but I'm not arguing the point. I'm not saying you're wrong.
Are you, so I don't know how familiar you are, but Rural Metro ran the city of Richmond and also multiple other large entities. It's because, but they did everything the same way. You've got people in there doing the same job. Inevitably, there's going to be some overrun. You're going to have to pull crews to do. You're going to have to pull that transfer crew to do 911 calls. There's going to be overlap. Those places are no longer in business. They've ran their employees in the ground, or you've got the same people in the same. If you're going to pay this guy X amount, why aren't you paying me this amount? I'll just go over to this side. It's causing conflict within each other, and
it's a quick way to tear a department completely in half. It's a good way to destroy a good setup. And just like Mandy said, the way that Henry County EMS used to operate, they attempted to do 911 calls out of Knightstown, Middletown, and they were also attempting to do transfers out of the hospital. So what would happen is the person in Knightstown or Middletown would get pulled to do a transfer out of the hospital, and there would be no ALS
Left Knightstown
provider.
wide open. And then who had to come?
And that's what happened exactly to they tried to do both, and it failed miserably.
Yeah.
And typically your transfer services are running 8, 16, 12-hour shifts, usually 8s, maybe 12s, where we operate on 24s. We have shorter transport times for the most part, but some of these transfers are 3 and 4 hours long, where you're managing an ICU patient for 2 hours on your own, where you just left a facility that's got 6 people caring for this person. It's taxing.
So I don't want to belabor the operational point. I don't think that's our role, but we just need to understand, are things operating the way they need to be for the citizens, and what the costs are going to be. So Mandy, you alluded to advanced and ALS, getting back to that, possibly adding an additional truck, more employees. How will your budget change compared to what you have now for next year and the year after? You said you could even be advanced before the end of this year.
We are advanced now. We'll
Okay.
be ALS, which is them.
You could be ALS
But
by the end
for-
of the year for transports?
Yeah, so
Okay.
we will, to pick up the transport, and honestly, that's for the citizens of the county.
Oh, absolutely.
There's no other reason for us to do it.
Yeah, I'm not
It's-
questioning it
yeah.
at all. I'm trying to figure out if you've got enough money to do
Right.
what you need to
we pull
do.
in alone, no. There's no way we can do it. It's why we asked the hospital to give us money to cover the payroll for medics. And it was a good solution, and we thought an easy win for them, but they didn't, because then that would transfer to all those patients and all the patients in the county. Because if they needed to go to a higher level of care, they didn't have to send their people because it was burning all of them out. We could hire the medics under the same protocols, using their equipment on our trucks. It would have been exactly the same, and then a patient wasn't going to get a $5,000 bill in the mail 6 months later.
Can you build them like you build the nursing homes for the PCS? That
They're
doesn't
never-
work that way, huh?
no,
It was a good thought.
No, it'd be great.
Yeah.
The hospital did not bite at that solution, did they?
No, they have a
No.
private service, or a different service.
So if
So,
the
I mean,
hospital
they-
calls,
They are using services that balance bills.
I'm not saying anything.
so yeah, so if an ALS transfer comes from the hospital now for a citizen, they're billing their
More than
insurance
likely going
and
to.
whatever else is being billed to that individual.
Well, I don't know whose service that they are using.
There's a couple of services too that have stopped.
Anything they can get
And I'm
all the
guessing
private
it's because-
services. Yeah, they
I
are
saw,
valid.
I just saw 2 ambulances from Union City, Ohio, here doing ALS transfers yesterday, so.
Doesn't seem cost effective, but I'm sure they figured something out, but
And it's hard on the it's hard on the citizens because, you know, I've had a recent family member in there that has waited 12 plus hours for an ALS transfer, multiple days. It's not
it's not
people
uncommon.
telling horror stories to get a react, that is the truth.
it's not
but it's hard on
patient friendly.
people.
It's more
Where,
for,
like you heard Justin say, transports are 3 to 4 hours. So that's our turnaround time.
Yep.
That's our turnaround time to come and get another patient.
So that's what we would like to do. I mean,
And
that's what our goal was. You know, if we get that set up to where we can have a truck sitting here in town, and there's a patient that needs to go to Indianapolis to get, you know, they're having a massive stroke or something critical. We can say, yeah, it's not going to be 4, 5, 6, 8, 10 hours. It's going to be, hopefully, if we have a truck on station, it's going to be 10 minutes. We'll have them there. We'll get them loaded. We'll get on our way. The most, they're on their way back from Indianapolis from another transfer, and it's going to be a couple hours. But I mean, you know, we're not looking at multiple days to keep our.
And yes, we get calls from patients who are in the hospitals.
Yeah.
Happens all the time.
Yeah, they just try to override the whole
They
system. and call
they're
us
going
correctly.
around trying to, and I can't, I mean, I almost want to say all these things, and I'm not going to.
Right.
It's like, I wish I could take you. You know, I'm sure they're doing the best they can.
now, I know that,
I do want to make a quick point, though. We still do take emergency transfers out of the hospital.
Yeah.
If somebody walks in and they're having a heart attack,
Yeah.
they call us, and we've still went out and taken those people. We're not leaving
Yeah.
emergencies sitting in the ER. These are patients that are managed well in the hospital. They're just needing to get to a higher level of care. When they've called us for emergencies, we've taken care of those emergencies, and we treat them just like you were to call 911 in front of this building. We treat it the exact same way.
Southwest is defunct. Is Middletown still in operation?
Yes.
I thought so. And are they solvent? I don't know. I don't know their status.
They do a pretty good job up there. They staff full-time, or I say full-time, they staff their ambulance with a driver and an EMT 6 a.m. to 6 p.m. Monday through Friday. We spend a lot of time up there on the weekends. That's just no secret. I mean, if Phil was sitting right here, I would say the same thing. He would agree. And then through the evening time, sometimes they are able to produce a truck after the 6 p.m. hour. It's just dependent. You know, they're short people too. Nobody wants to go to EMT school. They did get, I think, 4 or 5 out of the last class. And so they've been able to keep their truck on the road more in the last year, 6 months probably, since they finished that than the 6 months prior. But we still do send a paramedic up there as well. And I know you're thinking, well, if these guys can't hire paramedics, how are these guys going to hire paramedics? They hired part-time paramedics. We'd already pulled our employees. You know, they would go do that transfer work because you have a different mindset going into that. You know, so as they grow and do that, you're going to see a lot of employees that work both places.
The gentleman from Fort Wayne yesterday, he was saying that 5 to 10 years ago, they did all of Fort Wayne and every township and every town, the whole county. And just because of cost and staffing, his staffing's like 60% of what it was back then. They've had to cut back on several of the townships and several of the smaller towns. So they're pretty much just within, you know, about 5 miles of Fort Wayne. But it was just that they could not continue, mainly staffing being the limitation.
Well, I don't know if you've seen the news when the IMS article hit the news a week ago or 2 weeks ago, how they were short so many paramedic trucks, and how was this right for the city and the citizens, and the township departments out there too. Some of the township departments, you know, have had to go to Indianapolis City and say, we're not sending you all our ambulances because then we have to call ambulances from neighboring departments to take care of our calls. It's just a big trickle effect. Last night was a prime example of true mutual aid. They were all on calls. They had fires and emergency calls. We went, not just, we can't make up each other's shortfalls in staffing. That would be a disaster, and that's where mutual aid contracts and stuff come into play too.
Mandy, a couple years ago, you had indicated when you were reorganizing, kind of survival mode, you gave some equipment or ambulances to the city. Is there?
We transferred the ALS equipment. Some of it was good, some of it wasn't, and a couple of squads. But just like any other equipment, at this point now, even if we were to ask for it back for some weird reason, we'd have to trade it in on upgraded equipment because it would have ran its course by now. So they didn't get like top of the line stuff that was very well taken care of, if I'm being honest. It wasn't.
Okay.
Because nothing here really was really taken care of.
And you're planning on remounting some over the next couple of years?
I have, we have the 2 remounts that we already got, and then I paid the last payments on the Southwest ambulances and purchased those. And then I have one coming in February that I ordered with grant money, a new one coming in February.
And Brian, you said it's like a year out when you
Yeah.
order.
We should already be in the pipeline for another one, but there's no way I can order another truck and not know how I'm gonna pay for it.
Right.
So,
Because that bariatric truck was ordered a year and a half ago.
almost over 2 years
Over 2
ago.
years ago.
Yeah.
And you do have it now?
It's coming in February.
Wow.
I'm going to try and get us back to the dollars, if you don't mind.
Well, that's what we're about.
But I mean, that truck by itself is $317,000.
The
So-
budget, back to the budget, I told you you had $803,000 budgeted. Last year, you had $690,000 budgeted, and the report I'm looking at, which looks like it was in November, your year-to-date was $493,000. So do you know how you ended the year 2023 at this point? Did you get close to, and I understand these are not general
I think
fund
we
dollars.
actually did get close to what we requested in the budget. It was, it was, if
So-
not
so
just
it was
over it. Yeah.
really close?
Our
Yeah.
December report indicated.
Okay.
Yeah.
I just don't have the most recent report.
Yeah.
Do you think you'll get close to the 803,000 this year, or you think it and then
I don't know.
in order to do everything that you want to do, you need dollars. And that's what I'm trying to get to is if you guys heard my spiel starting this out, we're talking about lit. I can't just impose a EMS lit and say, I think we need this amount. I need to have some basis for we're taxing our citizens. I don't want to overtax our citizens. I don't want to tax them unnecessarily. But if we need dollars to meet the needs of our citizens, to do what you're talking about, Mandy, and to be able to cover the costs, our share, whatever that $300,000 number is, or whatever it ends up being, it's not. I need to know what we need to do to be able to come up with the dollars to make sure that our citizens are taken care of by both organizations. So can you guys help me to
go
try to
back
identify
ALS,
those dollars?
2025, you would add $350,000 right off the bat. That's one truck, one medic, 24/7, 365 days a year. Right off the bat, I know that number.
So,
That's for payroll purposes.
That's a payroll. That's just getting one medic on a truck 24/7.
okay, 0.03% EMS would bring in $330,000.
Do a,
He's talking about a
0.03
local
lit
income
rate,
tax.
EMS lit rate, if we were to pass it, would bring in currently $330,000, about a third of a million annually.
yeah, okay.
350, can you repeat what it's for again? You said one medic on one
That
truck?
would pay for one medic 24/7, 365 days a year. So
Okay.
we would have one ALS truck, a medic and an EMT to do transfers and back up anything they may need. I see that need growing. There's a lot of, there's really nothing that stays in Henry County. I don't think that people really realize that if there's anything critical, one, if it's a STEMI or a stroke or something like that, these guys are going to go take it. Because those people have to go, and there's a limited amount of time. You have a window to get them to the next place. They're going to go take it. But anyone else that has any kind of issues that may be stable in the moment, they're not getting treated here. They have to go somewhere else. And the calls aren't, I mean, my calls have went up. I'm sure your guys' calls have went up. They're just going to continue to go up. We're all going to need more people and more trucks and all the things.
And the cost of a call continues
Yeah.
to go up.
And we're still not bringing in more money, but yet everything has gone up. Everything, supplies, oxygen, gas, you name it, it just keeps going up.
That's a given in everything that we're trying to
So
budget.
that doesn't include the cost of, is it the bariatric? What did you say you needed to order, but you couldn't put in?
I have a bariatric truck coming. It'll be here in February. I got grant money.
Okay.
It's a grant that I applied for a long time ago. It's just taken 2 years to actually get it
Okay.
here.
And what's
So-
the one you said you needed to put in the order for, but you can't?
I said we need to put in an order for, we should technically, by the way that you, yeah, and same with them, we should already have another truck being built in the pipeline.
You don't wanna wait until your
okay.
trucks are breaking. That's
Yeah.
kinda what we
Gotcha.
stumbled into whenever we
And
got
then you
here,
would
all
kind
the
of
trucks were
retire
out
the one of the
service,
trucks, and then you just keep,
so Get on a rotation.
you know,
And how much is the replacement cost for those?
300,000 or 400,000.
330 to 400,000.
So by the time something's decided, it'll be 350 to 375.
And that's just in a couple of years, because the remounts that I have over there, one of those I got for $137,000 for a Ford F-350. And then if I was to get that now, it's like $246,000 for the exact same truck.
How long do they last for? What's their life?
It depends on how much you run them.
So a remount's just taking the box and putting it on a brand new vehicle.
Yeah,
So
so-
it's just, it's like having a brand new truck, but you're still using all the same electrical components and all the box where the patient compartment is. So, I mean, well, I don't know, you get probably 1 or 2 remounts out of I don't know how many remounts you get out of one box, but
Typically one.
one.
So how long do
depends
you
on the
guys expect them to last? I mean, based on how you run them, but I'm basically just trying to plan vehicles for the next few.
I mean,
If you were to pick up the ALS transfers, that's going to shorten the life of
Yeah.
the vehicle.
Yeah, we'll be going
but we
out
do
to
take
something a lot
really
more.
good care of them. We have a very tight maintenance schedule. I mean, everything is very well taken care of. Tires get changed when they need it. We don't just plug tires, we just replace
So
it.
let me ask like this. What vehicles do you think you'll have to purchase in '25? What vehicles do you think you have to purchase in '26?
It depends on the mileage.
Yeah, I mean, I guess I could say I should technically by 25 be asking for a truck, for at least one truck, based on,
Okay.
But
And then
I-
what in '26? Nothing for a year, or
Yeah.
you need one every, I'm just,
I would like to be every other year putting one in the pipeline. Is that about what you guys?
I'd say you need a truck a year if you're going to do it one at a time. Otherwise, you're going to need to do like 2 at a time, depending on how big a fleet you got. You know, we've got a little bit larger fleet. You know, it was bought 4 at a time, and so we're trying to get on a little bit more manageable fiscally remount program without having to buy 4 trucks, because 4 trucks is over $1 million. You know, so. You know, if you tell her, if she, I'd say a
mean,
truck a year for Mandy.
That's, I
and
mean,
that's how
I
speak
would
for
say,
her.
yeah, I should probably put one in the pipeline. Because we got those in 2020, one's a 2021 and 2022, and we have a 2023. So yeah, technically, and I should be ordering one 2024, 2025, because we are gonna have to let those other trucks.
Yeah, you're probably looking at 150,000 miles,
Yeah.
whether for a remount or replacement. I mean, if you get one remount, you're probably looking at 150,000 miles. And it just depends, you guys do more shorter runs. They do, Wayne Township in Indianapolis, their runs are short. They're within, probably 7 minutes maximum to any hospital within 7 to 10. So, they do 12 runs or 18 runs in a 24-hour shift. They may run less than 100 miles, where you guys do 18 runs in a 24-hour shift. You're building hundreds of miles.
I'm going to guess
So
you
if-
make quite a few runs to Indy hospitals for more severe cases.
Yeah, you almost have to. If we assume you're going to have one ambulance every budget, you're talking, what dollar amount? $300,000? $400,000?
If you buy trucks and remount them, like our plan is, we can get 2 remounts out of these Lifeline branded boxes. and ambulances, you know, so then you're just having to buy that chassis.
Buying the
They put
chassis
the
and
box on the new
spending the
truck,
money to
they go
rebox it,
through
yeah.
it.
I'm
you
trying
know.
to get to a dollar amount
Yeah,
for it. I'm looking at your budget, right?
But, I mean, there's gonna have to be a range, I mean,
I'm fine with a range, and that's okay, and that's,
you know, 300-400, yeah, 350, I think I've heard 3 or 4.
so if we heard 350 is what you need, we're hearing another 350 that you need annually to replace ambulances. So that dollar amount, above and beyond what you have in your budget, is what is needed to make your service sustainable in the foreseeable future.
They'll have some ALS costs and supplies and stuff too.
I wish I'd known
You know,
you was
it's
gonna wanna
hard.
know exactly what it was gonna take to maintain in the future, because I would've had it ready for
Sure.
you. But
We
just
got
off
to
the top
start
of my
somewhere,
head-
and that's what I'm
Right.
trying
It
to
doesn't
get
have to be tonight.
Yeah, and I don't want to start
Right.
at low
If I
and
needed a
do it
truck,
again.
if I needed a truck, say every year, and I'm gonna remount for the first couple of years, I would say with what we bring in, billing, right, because I'm always thinking of that, and then what I might need in help. So I would say 300,000, let's just call it an even number, 300,000 to do a remount once a year. And that's if, hopefully they come down, I'm hearing they're never going to, even if things became cheaper, because we're already paying that. And then you got, if we go back ALS, and you've got the medics, and that's gonna be $350,000 for that. Then I've got equipment, which Brian and Justin have offered to loan to us until we can get our own. We are currently looking for grants for that. But I need like $100,000 in equipment to go ALS alone. It's just, we were able to go ahead and do that because they offered us some of theirs, which we are appreciative of. I can also potentially go into a contract to get that equipment. That way I don't have that, I have a payment, kind of like with ambulances, and I wouldn't have to have all of that right off the top. So that's kind of, I don't know, do you want a number for the whole amount, or do you want me to give you what I think a payment might be, probably 30 or 40 grand a year? If I
I
went
think we're
into
getting
like a
closer to the
contract.
range that I'm looking for. I don't want to leave anything out. I don't want to go in and say, you know, we've calculated all this, and a .03 EMS
Right.
lit will get you what you need.
Right.
And then you come back and say, oh, well, we need to
Okay.
put an
I
ambulance in
get
every
you.
year.
Okay, so then you're going to add all your ALS supplies, your ALS meds,
Right.
and that's a greater expense. Medicines aren't as expensive as people might think, but all the other things are. You know,
And some
like
of
you
these
got-
ALS transfers you will be able to collect on, and some of them you will
So,
not.
yeah, exactly. You
So-
don't, and, because the same thing applies. You would think, well, if it's ALS, that's automatically gets billed.
Right, no,
Not if they can find a way not to.
Right,
It's
understood.
you're almost trying to convince them, and it's what happens, but you're trying to convince people you don't know, who don't know anything about EMS, that these people really needed this, and they needed to go. And it's maddening, and I wish I could be in the room over their shoulder saying, why'd you mark that out? That happened. But that's what they do, and we can't fight it.
right.
So we're going to need all that, and then you got to figure if we start doing the ALS transfers, which is the goal, then my fuel is probably going to double. So
Yeah.
that's 25, bringing that up to 25 or 30,000.
We're getting closer. I hate to be the one
Anything else
belittled in
I
the
can't
point
think of?
and pushing you towards numbers, but that's what we need.
Exact numbers tonight, Mandy.
We don't.
They can all go back and kind of do homework and.
Sure.
get to you
Yeah.
guys.
Yeah.
I mean,
Sure.
I think they've given you rough estimates of what.
Which is exactly what we need. And I know we can't get down to an exact number, and that's okay. We needed to know what kind of a range we're talking about to be able to make this work, so.
We
And
may not
then
be able
we've
to.
got to, our payroll will go up as well. So, because if we're going to staff an ALS truck, we're going to pay for either an advanced EMT or EMT at an increased rate. That's a little bit more pressure to be on a truck like that. We do have new, in fact, we're going to put in an advanced EMT job position because we've never had one. So a payroll is going to go up, plus just to stay with what current, excuse me, I just had a stroke. Current rates are, if we don't stay with current rates, we're not going to keep our employees because they can go all these places and
That's-
get bonuses and make $20 an hour. So,
We hear that across the board.
yeah, so we have to
We're not that
stay
competitive in a
comparable.
lot of areas.
Yeah,
Now, and we may not be able to do everything you're asking.
right. I'm just trying to give
Especially
you
in one
everything I
year,
can think
We may
of.
not be able to do 100% because we also have needs in the judicial area and other areas in the public service. But some of the things we're going to know more in a few months depending on legislation for example, if they do 500% reimbursement rate of Medicaid or Medicare, both, that's going to help. And these are unknowns as of today, but
Right.
it will help.
Yeah, it'll help. It won't move the dial much after everyone gets done picking apart there, but anything would help, right? Anything helps. It's better than what we're getting. That's why even the little 7.07% that they added, that, you know, that helps. Of course it helped, because it's better than not it going less or not getting it at all. And I've said that for, I don't know, I'll take $1 over 50 cents any day, right?
We need to wrap this
So-
up. Other questions from the council?
I got a couple of questions on numbers.
Yes.
Real quick, Shannon. So you said the .03, what's the max? Is there a max on that EMS?
I don't know if there's a max on the EMS, but we have a maximum for the entire local income tax that we're currently at 1.8. The max we can get to is 2.5.
Okay.
But the state average, I believe, is 1.89, and so we don't want to overtax, right?
Sure.
And I had this conversation with the volunteer firefighters. They, as part of the House Bill 1454, they can ask for 0.01 to 0.05 of the public safety lit for their use, and every volunteer fire department I talked to said, we want 0.05. We need 0.05.
Right.
Well, they don't have any budget to show me what, and I have no question that they'll spend 0.05. No question. They've been neglected for so long. They need it. Right. And so they'll spend 0.05 and wish they had more. And my concern for them was, okay, I don't want to overtax 0.05 for in year 4 or 5. You're coming back saying, well, we really didn't need 0.05 because everything's new, right? So we need to find out what that sweet spot is to be able to get things where they need to be, not overtax the citizens, provide them with what they need to, and make things self-sustainable for you guys. Same process. So the 0.03 it brings in about $330,000. The income of all residents in Henry County, a little over $10 million. And of course, incomes change and go up, and people move and things. So it's a variable. This is an income tax that we're talking about. Right. So.
And the state's talking about reducing income tax, payroll reduction, state income tax, which means they're going to have to up the property, which they put a cap on last year. So the only opportunity we have is to raise people's taxes. They set up there, put a tax cap on, put a limit of how much we could raise as far as property taxes could raise, nowhere close to inflation rate. So like 0.05 would bring in $550,000. It's basically $110,000 for every 0.01. So EMS has a need, fire departments have a need, the judiciary, they give an 8% raise, the state did. Those are state employees for the most part across the street. We have to pay, they're state employees. They get an 8% raise. We have no say in that. We have to pay for it. So they say now they added a judicial lit, like they added a jail lit a couple years ago. They are changing the jail lit so we can do more out of operation. That'll give me some flexibility to move things around in sheriff, jail, et cetera.
And we need to have some internal discussions amongst council about how are we going to do this. I mean, we're right now paying for the payments to Newcastle EMS out of public safety lit. It was ARP before that, and before that there were no payments, right? So that's an expense that we have to consider moving forward. Maybe all the expenses for this needs to just be part of public safety lit. We need to evaluate those things to decide. But that's what I'm trying to do, is get a number as to what to do. We only have so many opportunities to change lit rates. We can only do it once a year as county council. The tax council can also do it once a year. So we need to look at what we want to do, also have some conversations with the city to decide what they need to do and how these things need to change. So there's a lot of moving parts here. I appreciate everything you guys have shared with us. It has given us a good overview of what's happening and what's coming on in the near future. So thank you.
We appreciate you working together.
Thank you.
That cooperation, I think, helps a lot.
Sure. It was brought to my attention too that city residents pay 2% additional property tax for services as well. Trying to do some research on that. So if anybody comes across any of that while they're doing their research, I'd be glad to take your findings. I've talked to Debbie about it too, and just, you know, want to make sure we got all our ducks in a row.
All I know is that Newcastle has maxed out their tax rate, so I have no doubt that that Newcastle residents pay more in taxes. I didn't know the 2%. Yeah.
My understanding is 3% comes to the county, 2% comes to the city property tax.
Well, it has to do with
I'm
certified-
learning, trying to figure that one out.
It has to do with certified shares, and the DLGF distributes that. And in fact, council, we just got that report for 2024 last week from DLGF. The preliminary was shared by Jason Semler back on December the 5th, but the official came through last week. And you probably, somebody in your office, treasurer, somebody's got that report, but the DLGF is what determines that at the state level.
So is the EMS tax going city and county? Will it be?
No.
It comes to the county.
It's a this
County
council, county council can choose to pass an EMS lit, and all of the funds come to the county.
So it'd help your plans, but we'd still have to be looking at what to do with like the 300,000 that's been requested. We have to allow for that if that's a have-to situation. We have to.
I don't see that being able to get any lower anytime soon, just from my perspective of what we do here. Because we will never be in the position to be able to, they're already set up to do what they do, and they do it well. We don't need to do that. We just will help them do that whenever something happens, or they get, which has happened, I don't know how many times. Like, you know, they may have a 3-car pileup, and then someone has a stroke, and then you got grandma that fell, and then they need us, and we are best suited to work with each other that way. So
Well, we know
we're
it's
going to
a-
have to keep supporting them. They're already there, so why recreate the wheel if they have it? And let us rebuild to accommodate them, so that we're partnering together instead of trying to put us back in that terrible position that was potentially threatening people's lives, if we're being honest.
Right. I think back in 2020, that's what we're, in
It was
2019,
a
2020, that's
nightmare.
what we were hearing.
Yeah.
So I commend you for working together and planning together, and we know it's an essential service. We know if somebody calls with an emergency, 911 is an essential service. I think financially, we've finally taken care of that, because that was in a direction of ruin, bankruptcy, and we need to make sure your essential service is paid for, so that a person calls 911, they're not waiting an hour and the person dies in the interim. So, any
I mean, we
questions
just
from
do,
council?
we need them to get them to the ER and then get us set up to get these people out of the ER, because they're both equally important. One, you have an emergency, stabilize them, get them there,
Right.
but then they have to have the treatment that helps them get well, right? So we just need to work together to figure out how we can best do that, and that's for Henry County, because there is no one else that we support. We don't go out of county for out-of-county residents anymore. They're only in this county. So it's Newcastle and Henry County only, which is something this service always did before. They went to Blackford, to Bald, Ohio, to Cincinnati, to Dayton, to Cleveland. Like, just crazy runs. I hate it, but we don't do that anymore. We only serve the people here.
We-
Start and or stop.
Now, we'll go to Cleveland, Ohio, if we have a Henry County resident that has no other way to get home and that needs to be in an ambulance, we'll do that.
And Brian
Nobody's
said
gonna
he
want
was
to, but we will.
Charlottesville, which is what, west of Knightstown. South Side, you have any questions, comments?
Oh,
I got a good education about how all of this works. I went over a year ago or so on Southwest and a lot of the lingo. So it was helpful having a little bit of that knowledge still able to be recollected to hear it again tonight.
You gave a lot of good information, answered a lot of questions, which I think is going to position us better for budget time. And we'll probably be asking more between now and July. How are things going? Like Newcastle, you'll have about a year under your belt. You'll be able to tell us a little bit more, and just we'll figure it out. It just may not have 100% of it figured out in 2024, just like we had a 3-year plan for the sheriff's department. We could not do it all in a year.
Right.
So, anything else?
Help any way we can.
Thank you. You do daily. So, motion to adjourn? Read the notes at the bottom. I won't read them because you're big boys and girls and you can read. Motion to adjourn? Thank you all. Hey, it's very foggy, very, very foggy. Don't do something that you have to call 911 and ask for an ambulance.